Whether you're an essential worker who's been going to work all along or you're looking ahead to when you go back to work, one big question mark is what to do if one of your coworkers contracts COVID-19. According to the Centers for Disease Control and Prevention recommendations, if an employee is confirmed to have the virus, employers should let workers know they could have been exposed. But they're not supposed to say who under the Americans with Disabilities Act. But one expert tells HuffPost the CDC's guidance on notifying employees is not mandatory. That leaves people with a few options if you're protected under the National Labor Relations Act. You and your coworkers can come together and ask management to address the concerns about your working conditions. Fox 13 says employers should call the health department for advice if an employee tests positive, so you can ensure they have done that. If you have an underlying health condition or a family member does, you may be eligible for leave under the Family and Medical Leave Act that, while unpaid, protects your job. Through the Family's First Coronavirus Response Act, you may qualify for emergency paid sick leave. But the Washington Post says that between January and early April, the Occupation Safety and Health Administration already received over 3,000 complaints from people alleging they had to work alongside coworkers who seemed sick or that their workplaces weren't sanitary. And since the CDC and OSHA advice isn't legally binding, you could also reach out to your representative in Congress and call on them to pass legislation regarding this matter.